Today I'm coming to you with a video about rectal discharge. Nice. Before I start, rectal discharge you can suffer with if you have an ileostomy or colostomy. What is rectal discharge? It's a mucus that's normally produced within the bowel that acts as like a lubricant to aid with the evacuation of poop, waste. And this, if you didn't already know, continues to be produced even if you have a stoma. So even if you have an ileostomy or colostomy, the mucus is still produced to, in effect, lubricate your anus, unless you haven't got an anus, like me. The type of mucus, amount of it and frequency will vary from person to person. It's normal to continue producing mucus as it's your body's natural way of passing discharge through the body. The mucus should be a clear or yellowy sort of colour, and it should be of a liquid or like a sticky glue consistency. But on that note, if it does contain blood or pus-like consistency, then you need to speak to your GP because it could actually be that maybe you've got an infection. So things you need to watch out for. Some people will experience a build-up of mucus. This can cause some people to have leaks, or it could be that it can form like a ball in your backside basically and makes you have that feeling like you need to go and pass a bowel motion. You may also actually pass some poop, and this may happen several weeks or months after your surgery. This isn't unusual, however, I would suggest that you do contact your stoma nurse in this regard. Oh, and don't be alarmed if you do actually still fart, as this is normal too. What can you do to relieve these symptoms? When you have the urge to pass this mucus, what will feel like poo at the time, go and sit on the toilet and without straining, try and sort of gently bear down, and hopefully you might pass that mucus. And sometimes even just sitting on the toilet can make the feeling pass, a bit like phantom butt pain. If, however, this is becoming a regular occurrence and you actually can't pass the mucus, then I would suggest getting in touch with your stoma team or your GP, because this might be something that actually needs to be looked into. And in some cases, suppositories might be prescribed to help relieve this feeling. Hints and tips. Pelvic floor exercises, and that is for both men and women, can help to prevent leakages. Coloplast provide the Core 4 program, which is really good, so check that out on their website. But if you do end up experiencing leaks, and this is leaks down in the butt, not your stoma, then I would suggest maybe wear some pads to absorb any leakage, just to prevent any sort of embarrassment. Wear close-fitting underwear to keep these pads in place. I'm thinking more of you guys that wear boxers. Regular showering and keeping the area clean will help to reduce any skin issues. Use wet wipes to clean the area, especially when you're out and about. Use a barrier cream to help prevent the area becoming sore. And also, it might be worth keeping a note on sort of what you're eating and drinking, as there are some foods that could increase the production of mucus. I hope I've covered everything, but if not, then again, reach out to your stoma nurse, reach out to the clinical advisors of your stoma supply companies, because all of these can help. So yeah,